Hi, my name is Graham Walker. I'm one of the gynecologists at the Gold Coast University Hospital. I'm speaking to you today because you have been listed for a laparoscopic hysterectomy. What makes this unique in the Gold Coast is that we are pursuing day case hysterectomy, so you come in and you go home on the same day.
Today's video is just going to give you an insight into what it's going to be like on the day of your procedure. And at the end of the video, you're going to hear from two of our patients who have recently gone through a day case hysterectomy.
We are very much aware of the degree of anxiety that any surgery generates, in particular day case hysterectomy. So we have put together this short video clip to try and relieve some of that anxiety.
Our patients can use a variety of transport options to visit the hospital. Public transport is available and the tram line is straight out front. There is a public car park that accesses the hospital with an undercover walkway on level 1. Remember to take a location ticket so you can find your way back to your car. On entering the hospital, you will need to take the foyer lift to level 2 and enter D block in the peri-operative services area. Here you'll be greeted by the surgical admission staff who will assist you with your admission paperwork. Once completed, you may take a seat in the waiting area. You'll be collected by one of the admission nurses and taken to a private room to prepare for your surgery. Your nurse will confirm your details and consent form, perform some observations and place compression stockings on your legs. You will need to keep these stockings on for several days after your surgery. You will be taken through to the change room to put on a surgical gown, hat and underwear. Once ready, you can take a seat in the holding bay waiting area. A nurse will come to greet you and take you through to the anaesthetic bay. Waiting times are usually around 30 minutes. Your anaesthetic nurse will confirm your details and procedure and prepare you for your surgery. You will also meet one of the theatre nurses who will again ask you to confirm your identity and procedure. Your anaesthetist will come to introduce themselves, explain the anaesthetic process, place a cannula in your hand, and answer any questions you may have. Your surgeon will also come to talk with you about your procedure, what to expect, and to answer your questions. Once you are ready, you can walk into theatre and lay down on the operating table. It can seem overwhelming how many people are in theatre, but everyone is there to help with your procedure and to care for you. After some preliminary setup, your anaesthetic will begin to drift you off to sleep and your procedure will begin. After the procedure, you will be taken to a recovery area where you will stay until you are ready to move to the acute surgical area. Here you will spend up to 6 hours until discharge. You will need to be able to eat, drink, go to the bathroom, and have your pain under control. When you are ready, you will be prepared for discharge, where you will need an adult to take you home and stay with you for the next 24 hours.
Thank you very much for watching the video. Hopefully that's gone some way to reduce your anxiety. There are a couple of points we would like you to remember. Please, nothing to eat or drink from midnight. And one important thing is the holding bay, you're likely to be there for some time. You will probably get bored, so please bring a book or an iPad to watch. Remember, the holding bay is a mixed sex holding bay, so there'll be men there as well as women. Once you're discharged home, remember to go and see your GP at 3 weeks and at 6 weeks. Many thanks. All the best.
So you found out you need a hysterectomy. How did it make you feel knowing it was going to be a day case?
At first I felt a little bit anxious. I'd always heard that hysterectomies were multiple day stays. So when doctor told me it was going to be one day, I was a little bit anxious, not knowing how it was done in one day, hearing that it was 3-day stays.
Yeah.
But interested to know how it could happen, because I would rather be at home than be in hospital anyway. So excited at the same time.
And do you feel like you were given enough information?
Absolutely. I was given so much information. I probably asked way too many questions, but all of those questions were answered, and I understood. It was answered in a way that I understood as well.
Yeah.
So put my mind at ease. I knew exactly what to expect.
Okay, so it's a day of the surgery.
Yeah.
You're coming into hospital. How do you feel?
Great. I feel good. I know what's going to happen. I feel really confident in my doctor, my nurses.
Yeah.
There was nothing for me to feel worried about. I knew how the day was planned and how it was going to pan out as well. So 100% confident.
So not many people come into hospital going, great, I'm having surgery. So what was life like for you before having a hysterectomy?
Before having a hysterectomy, day after day after day, it was an internal torture. I had so many different symptoms from what I was suffering, and for a long, long time. So I tried to tackle it by all different angles prior to my hysterectomy, with nothing working. So the hysterectomy for me was a no-brainer to go that way.
Okay. So you're in theatre. What's your first impression? Like, what's theatre like for women who've never been in there before?
I think theatre is, if you've never seen it, you don't know what to expect.
Yeah.
It's quite a large room, very clinical. The staff are super friendly and explain everything, have a joke with you. They put you at ease.
Yeah.
There's nothing to worry about. I was comfortable. I wasn't worried. I wasn't scared. I felt really good.
Excellent. On the flip side, you got to go home the same day?
Yeah, I did.
Yeah.
Awesome. Best decision I ever made. For many reasons. Mostly I was in my own home, so I had all my creature comforts there. I had my own bathroom, my own toilet. I had my supportive husband who could do everything that I needed done for me without having to feel like I'm hassling someone.
Yeah.
My children were there. It felt comfortable. Best place I could have been.
So you feel like you had peace of mind because you could see your kids.
110%.
Yeah.
And comfortable. You're in your own bed. You've got your own surroundings. Like I said, your own food. And you're not thinking, do I press the buzzer and get the nurse? I just yell out to my husband, he's there. Yeah. And you're going to be in a little bit of pain or discomfort, but you may as well be in pain or discomfort at home. It's no different. You're not going to feel less or more depending on whether you're at hospital or at home.
Yeah, so being at home, did you still feel supported by the hospital?
Absolutely. So after I got home, I knew that it was just a phone call to my nurse Paula. Any questions, anything that I might have been worried about or needing advice on, it was just a phone call. And I knew that I would get her straight away.
Excellent. So you survived the day surgery.
Yeah.
Life's really good.
Yeah.
Tell us, how good is life post-hysterectomy?
It is so good. It's like opening and shutting a door. It's on the other side of the door. So I have more energy. I have less headaches and less lethargy, which was due to blood loss and all that sort of stuff. I don't have to go out worrying about having an explosion or a mishap or something going wrong. And every single day was like an internal struggle for me. Now I don't have to worry about a thing. It's fantastic.
Confidence back.
Absolutely, 100%.
Time back.
Yep, for sure.
Think the family's noticed?
Yeah, absolutely. Yeah, absolutely. They've noticed big time. Yeah.
So if you could say one thing to a woman who's going to come in, be told they need a hysterectomy and be told that it is a same-day surgery, what would you say to them?
I would tell them to look at it as a positive, that they can have complete confidence in the staff, the doctors, the nurses. When they go home, they're a phone call away. You can always come back to the hospital if you need to. You're at home, you're comfortable. There's nothing, it's the best decision you'll make, absolutely. Going home on the same day, wouldn't have it any other way.
Okay, I did get told that I was having hysterectomy and going home the same day, and it surprised me, alarmed me, and I guess I just had to place a lot of trust in my doctor. The staff that I've dealt with from the very beginning right through to the end have been brilliant. Brilliant. They just give you every bit of information that you need. Any questions, they answer. it's great. Day of the surgery. Packing my duds. It's surgery, it's major surgery, and I'm losing quite a few bits of vital life organs that, yeah, I don't apparently need anymore. I pulled up in the car park and actually sat there for a little bit before I walked in, I have to be honest. Psyched myself into it, came in, sat down, and from then on, every single person that I came across just eased me straight into everything. Right down to the very last person that I saw before I went under was the loveliest lady, and she just calmed me completely. So it was good, really good. Before the surgery, I've had 12 months of hell. I've been in pain every single day, and there's been just medical issues, one after the other. Lots of specialists, lots of I don't knows. And then when I finally got the answers and they found what was going on and said, right, this is the solution, it was a huge relief, huge relief. When I woke up, I do remember thinking, I'm nowhere near in as much pain as I thought I'd be. I do distinctly remember thinking, this is nowhere near like I thought it would be. All the nurses were lovely, brought my family in as soon as I could see somebody. I haven't had an issue from start to finish. It was great. As much as I think it would have been great to stay, I felt much better going home to my bed that night. I was still very groggy, and I was a little bit sore by the time I got home. My daughter actually went to Kmart and bought this really thin, I looked at it and thought that's the weirdest thing, but she bought me a pillow, and so I strapped myself in with the pillow, which really helped to travel home. Got home, got myself upstairs, she helped me get into my nightie. I flaked out in the bed and I just thought, oh, thank God I'm home. It just felt lovely to be home. As soon as I got home and I was in bed and I was fine, the next day I felt really, really supported by the staff. I had a call straight away the next day, and then they followed through nearly every day for the whole week, just checking on me, and then a couple of weeks later. So yeah, it was almost like I was still in hospital. It was great. Post-hysterectomy, my life is 100% different. I'm back exercising, I'm 100% free of painkillers, haven't had an ounce of pain. I think I had a little bit of pain after the surgery for maybe 2 days, and then after that, nothing. Brilliant. If you're given the opportunity to have a same-day hysterectomy, take the opportunity. It is the best thing that you will ever do, and you won't look back, and you will be fully supported, and you will feel 100% afterwards.